Hello everyone and welcome back to our channel Quaint. Today we are going to discuss a very important but often misunderstood topic. The topic is heterosexual vaginal sex. Yes, this is the specification. Heterosexual, this term is there, again vaginal sex, this term is also there because different types of combinations are possible. Heterosexual, that means in this process, in this sexual activity, there is one male and one female. Then this term heterosexual is applicable, otherwise not. Because in sexual activity, maybe there are two males, maybe there are two females, maybe there is one male and many females, means multiple females, more than one female. Okay, maybe there are many men or better to say many males and only one female. So different combinations are possible. That's why the term heterosexual is most specific one. It indicates that in the sexual activity there is only one male and one female sexual partner. Okay, and the term vaginal sex is being used here. That means what? Here there is one male and one female, and here the male's penis penetrates the female's vagina. Then this is called vaginal sex. Otherwise, other procedures are also there, like anal sex is there, then oral sex is there. Okay, and self-sex methods, those are also there. Actually, those are called masturbation. So many types are there because since this is a scientific discussion, so here we need to be very specific in the discussion. That's why this term is being used, heterosexual vaginal sex. One male, one female, male's penis penetrates the female's vagina. Okay, this is the procedure. So this was the definition of heterosexual vaginal sex, and you know that this heterosexual vaginal sex is actually the primary biological method to produce what? To produce means for the production of human, means actually human reproduction. This is the primary biological method of human reproduction. This is better way to say the same thing. Okay, but this can involve what? This can involve certain risks if proper precautions are not taken during sexual activity or vaginal sex. So proper precautions, so you have the idea. What are the proper precautions? So let's discuss first the vagina. Something about vagina. You know that when sexual intercourse occurs or vaginal sex occurs, in that case, the sperm can fertilize the egg. And this leads to what? Pregnancy. This is known to you. When the sperm fertilizes the egg, in that case, that may lead to pregnancy. This is known to you. And if you don't want to get pregnant, in that case, what is the requirement? Contraceptive pills are there, condoms are there. But condoms are not used just to prevent unintended pregnancy. Condoms are also used to prevent STIs, means sexually transmitted infections. You know, so many types are there. Chlamydia is there, gonorrhea is there, syphilis is there, HIV, HPV. So many types of sexual transmitted infections are there. And again, the inside, means inner surface of the vaginal opening or the vaginal canal, that may contain micro tears. Okay, and you know that semen, means male's ejaculation, that is known as semen, that contains sperm and other secretions are also there, and that semen contains cells that may carry viruses. So there is a chance of infection. So if you don't want pregnancy, you must use condom. If you don't want to get infected with any types of viruses or bacteria or any disease, in that case you must use condom. And again, in case of multiple sexual partners, you must use condom. In case of multiple sexual partners, chances of infections are more. And if you are really sexually active, okay, means on a regular basis you involve yourself in sexual means vaginal sex, okay. So in that case, you should always get frequently or on a regular basis that infection screenings. Means STI, better to say STI screenings. You should go for STI screenings if you are sexually active. Okay. So you can see condoms. These are a must. These are always recommended by doctors. To prevent what? To prevent pregnancy as well as sexually transmitted infections. And one more thing, some men you know that they undergo actually that circumcision procedure, surgical operation. Okay, the foreskin is removed surgically. In that case, it has been already studied, and the results we know that this male circumcision, this actually lowers the risk of infection, especially HIV, because the foreskin actually contains certain immune cells which are easily infected by HIV. So they have a what? They are more safe than others who have not undergone that circumcision procedure. That does not mean males who have already circumcised, they are 100% safe. No, that is not correct. They are not 100% safe. Chances are lower than others. Okay, and one more thing, doctors recommend that inside the vagina you should not use harsh soaps because it can disrupt the microbiota, which is the most essential thing to maintain that balance of microbiota. Actually, vagina is a self-cleaning organ which contains which actually maintain natural pH and microbiota. That's why doctors always recommend not to use harsh soaps inside the vagina. Okay, means mild soaps are recommended. It's a self-cleaning organ. And doctors also recommend that before sex and after sex you should maintain hygiene. Okay, clean hygiene is required before sex and after sex. Clean hygiene is required, and you know it better that all the people do not maintain all these things and they get easily infected with viruses. Okay, so you know this thing because everyone is not well educated. They actually don't know all these things. That's why they become casual and involved in sex without any protection. So chances are more to get infections. So many things are there. Again, vaccination. Some preventable vaccinations are there. I mean, some vaccinations are there which can prevent certain things like hepatitis B. Okay, this is preventable, and for this thing, vaccination is available. Then HPV, for HPV, vaccination is available. So you should go for vaccination since vaccinations are available for these things. Right? If vaccinations are available and you are active in sexual, means you expose yourself in sexual activity in such cases. Okay, on a regular basis, if you do all these things in such cases, you must take that proper vaccination. That means what? That means both the males and females should take proper precautions if they regularly go for such vaginal sex. Yes, in this video we have discussed only about vaginal sex. For anal sex or oral sex, okay, different discussions are there, not the same. Okay, here the topic of discussion was heterosexual vaginal sex. So keep in your mind, if you are going for that anal sex or oral sex, different precautions are there. Anyway, so this was all about today's topic, and this is the end of this video. If you found this video informative, so please like, share and subscribe to our channel. This is the end. Thanks for watching.